I want you to go to your bathroom mirror again. I know we talk about the mirror a lot, but it is the most honest medical device in your home. I want you to turn on the bright light and lean in until you are uncomfortably close to the glass. Close one eye and look at the eyelid of the other. Specifically, look at the inner corner, right next to your nose, in that soft, thin skin between your eye and the bridge of your nose. Do you see something there? Do you see a small, slightly raised, yellowish patch? It might look like a little deposit of wax. It might look like a tiny splash of yellow paint that has dried under the skin. It feels soft to the touch, almost velvety. It doesn't hurt. It doesn't itch. It doesn't affect your vision. It just sits there, looking a bit like a cosmetic annoyance. You might have tried to cover it with concealer. You might have thought it was just a weird pimple or a sign of aging skin. I am here to tell you that this little yellow bump is not a pimple. It is not a skin tag. And it is certainly not just a cosmetic flaw that you should cover up and ignore. This bump has a medical name, Xanthelasma. And it is arguably one of the most important warning signs your body can give you. That yellow substance you see is not pus, it is pure, concentrated cholesterol. It is a deposit of fat that has spilled out of your bloodstream and settled into the skin because there is simply too much of it circulating in your body. If you have these bumps on your eyelids, it is a neon sign flashing on your face telling you that your arteries are likely clogging up, your lipid levels are critical, and your risk of a heart attack or stroke is significantly higher than the average person. Today, we are going to decode this signal. We are going to explain exactly how fat migrates from your liver to your face. We are going to debunk the myth that this only happens to overweight people. And I am going to give you the step-by-step roadmap to treating the root cause, your blood chemistry, so that you can protect your heart and stop these deposits from growing. To understand why xanthelasma forms, we have to look at the highway system of your blood vessels. Your blood carries cholesterol, which is a waxy, fat-like substance. Your body needs some cholesterol to build cells and make hormones. But when you have too much low-density lipoprotein, LDL, the bad cholesterol, it starts to look for places to park. Usually, it parks in the walls of your arteries, forming plaque. This is hidden. You can't see it. This is why heart disease is called the silent killer. However, the skin around your eyes is unique. It is incredibly thin. It is delicate. And it has a rich blood supply. When your blood is supersaturated with lipids, fats, the macrophages, the immune cells that act like garbage trucks, try to eat up the excess cholesterol to clean the blood. But there is too much of it. The garbage trucks get full. They turn into what scientists call foam cells. These are bloated, fat-filled cells. They have nowhere to go, so they get pushed out of the circulation and deposit themselves in the path of least resistance, the soft tissue of your eyelids. Think of it like a sponge that is completely soaked. If you pour more water on a soaked sponge, the water leaks out. Your body is the sponge. The cholesterol is the water. The xanthelasma on your eyelid is the leak. It is visual proof that your internal storage for fat is overflowing. Why is this so dangerous? Because if these foam cells are depositing in your eyelids, you can be mathematically certain they are depositing elsewhere. A study published in the British Medical Journal followed thousands of people for decades. They found that people with xanthelasma were significantly more likely to suffer a heart attack, develop severe atherosclerosis, hardening of the arteries, or die prematurely compared to those without the yellow bumps. The bumps are the tip of the iceberg. The iceberg is the plaque in your coronary arteries. The bump on your eye is soft, but the plaque in your heart is hard and brittle. That is the danger. Now, I want to address a very common confusion. Many people say, but I'm not overweight. I'm skinny. How can I have high cholesterol? This is the genetic trap. Xanthelasma is very strongly linked to a condition called familial hypercholesterolemia. This is a genetic disorder where your liver is unable to remove LDL cholesterol from the blood efficiently. You could run marathons, eat salads, and be a size 0, and still have dangerously high cholesterol because of your DNA. In fact, seeing these bumps on a thin person is almost more concerning because it indicates a genetic metabolic failure rather than just a dietary one. If you are thin and you see these bumps, do not assume you are safe. You are the person who needs to see a cardiologist the most. Let's distinguish this from other eye bumps so you don't panic unnecessarily. A stye is a red, painful lump at the edge of the eyelid, usually caused by an infected eyelash follicle. It hurts. Xanthelasma does not hurt. A chalazion is a hard, painless lump caused by a blocked oil gland. It is usually skin-colored or red, not yellow. Milia are tiny, hard white pearls under the skin. They are just trapped keratin. They look like grains of sand. Xanthelasma is distinct. It is yellow, or orangish, flat or slightly raised, velvety/soft, and usually sits in the corners near the nose. And it is often symmetrical. If you have it on the left eye, you probably have it on the right eye too. So, let's say you look in the mirror and you confirm it. You have the yellow bumps. What do? The first instinct is cosmetic. You hate how it looks. You want to cut it off. You want to go to a plastic surgeon or a dermatologist and say, zap this off with a laser. And you can do that. They can cut it out, they can freeze it, cryotherapy, or they can use a laser to vaporize it. But here is the hard truth: if you remove the bump without fixing your blood, it will come back. It almost always grows back. Why? Because the leak is still there. You are painting over mold on a wall without fixing the leaking pipe behind the wall. The mold will return. The bump is just the symptom, the cholesterol is the disease. Your first call should not be to a plastic surgeon. It should be to your primary care physician or a lipid specialist. You need a full lipid panel. But don't just settle for the basic numbers. Ask for a deeper dive. Ask for LDL-C and LDL-P, particle number. Ask for ApoB, apolipoprotein B. This is a more advanced marker that tells you exactly how many atherogenic, plaque-causing, particles are floating in your blood. Ask for LP(a), lipoprotein a. This is a genetic sticky cholesterol that is highly linked to xanthelasma and heart attacks. It is not tested in standard checkups, but if you have the eye bumps, you likely have high LP(a). Once you have the numbers, you have to get aggressive. This is not the time for half measures. If you have visible cholesterol deposits on your face, watching and waiting is not a strategy. You need to lower the LDL, and you need to do it fast. Let's talk about the diet. We need to stop the inflow of saturated fat. Red meat, butter, cheese, cream, coconut oil, palm oil. These are the drivers of LDL. If you have xanthelasma, these foods are fuel for the fire. You need to switch to a diet that actively pulls cholesterol out of the body. We need soluble fiber. Oatmeal, beans, lentils, flaxseed, chia seeds, apples, pears. Soluble fiber turns into a gel in your intestines. It binds to cholesterol and drags it out of your body before it can get into your bloodstream. It is a natural chelator. We need niacin, vitamin B3. Niacin has been shown to raise HDL, good cholesterol, and lower triglycerides. However, high doses can cause flushing, so this must be done under doctor's supervision. We need garlic and onions. These contain sulfur compounds that help stop cholesterol from sticking to artery walls. But let's be realistic. If your cholesterol is high enough to leak out of your eyes, diet alone might not be enough. This is where you have to have an open mind about medication. Statins, like Lipitor or Crestor, are the most effective drugs we have for lowering LDL and shrinking plaque. Many people are afraid of statins because of muscle aches. But the risk of a heart attack with xanthelasma is real. The risk of side effects is small. There are also newer drugs like PCSK9 inhibitors, injections, that can drop cholesterol by 60% with almost no side effects. If you have the yellow bumps, you are a prime candidate for these therapies. You are not preventing high cholesterol anymore, you are treating established lipid disease. I want to talk about the partner symptom again, arcus senilis. We discussed the gray ring around the iris in another video. Xanthelasma and arcus senilis are the toxic twins. If you have the gray ring and the yellow bumps, your body is screaming at you. Please, listen to it. There is also a connection to the thyroid. Hypothyroidism, an underactive thyroid, can cause high cholesterol. If your thyroid is slow, your liver cannot process fat. The fat builds up. The bumps appear. If you have the bumps, make sure your doctor checks your TSH levels. Sometimes, simply taking a thyroid pill fixes the metabolism, the cholesterol drops, and the bumps stop growing. Let's address the home remedies. You will see videos on the internet telling you to put garlic on your eyelids to burn off the bumps. Or apple cider vinegar. Or castor oil. Please, do not do this. The skin of the eyelid is the thinnest skin on the human body. If you put raw garlic or acid on it, you will cause a chemical burn. You can cause scarring that is far worse than the bump itself. And if you get that acid in your eye, you can damage your cornea. Do not treat your eyes with salad dressing ingredients. Treat the internal chemistry. Can the bumps ever go away on their own? Generally, no. Once the foam cells are deposited, they are stubborn. However, there have been cases where aggressive lowering of cholesterol, getting LDL below 70 mg per deciliter, has caused the bumps to shrink slightly or at least stop getting bigger. But the primary goal of treatment is not to make the bumps vanish, it is to stop them from killing you via a heart attack. Think about the psychological impact. I know these bumps make you feel self-conscious. You feel like people are staring at them. But I want you to reframe this. This bump is a gift. It is an early warning system that many people don't get. Many people find out they have high cholesterol when they are in the back of an ambulance. You are finding out because you looked in the mirror. You have been given a head start. You have been given time to change your diet, take the medication, and clean out your arteries. Use the vanity as motivation. Every time you look in the mirror and hate that yellow spot, let it motivate you to say no to the bacon. Let it motivate you to take your evening walk. Let it motivate you to swallow your statin. You are fighting for your face, but you are winning for your heart. Let's recap the yellow bump protocol. Don't touch, do not squeeze, pick, or burn them. The test: get a full lipid panel, including LP, A, and ApoB. The thyroid: check TSH levels. The diet: cut saturated fats drastically. Increase soluble fiber. The meds: have a serious, non-fear-based conversation about statins or other lipid-lowering drugs. The removal: only consider cosmetic removal after your internal levels are stable, and use a professional board-certified specialist. We often ignore the little changes in our appearance. We think they are just age spots. But your body is a brilliant machine. It connects everything. The skin is connected to the blood, which is connected to the heart. Nothing happens in isolation. If you have these bumps, do not be ashamed. Be active. Be the CEO of your own health. You have seen the sign. Now you know what it means. The road ahead is clear: clean the blood, clear the arteries, and live a long, healthy life. Thank you for listening. This is a small sign with a big message. Share this with anyone you know who has these spots. You might just save a life today. Stay safe, stay observant, and take care of your heart.